Hi, this is Wapio. Welcome to my home. I wanted to talk to you about something that's pretty exciting for me. It's our correspondence course, and we have an amazing correspondence course. I'll tell you about it in a minute, but what I want to say first is that lately we've had a lot of requests to have another start date for our course, so we've decided to do that. We have a start date in May 23rd. We're starting again a new year, all right? So if you want to participate with us, let us know, all right? Here's what's going to happen. First of all, I'll tell you about the course. Truly, if I were going to study midwifery, this is the way I would want to study it. Why? Because we're studying the textbooks, we're studying the anatomy and physiology. We've also got videos. As you do your work, all right, in the reading, we'll also have a whole video library that we're going to share with you, basically of me teaching in a classroom setting many of the lessons that you're going to be asked to learn. So you'll be doing the reading, and you'll be reading from amazing people. The academic component of our program, first half of the year, pregnancy, prenatal care, anatomy and physiology, and so on. We're using Anne Fry's venerable tome, Holistic Midwifery, Volume 1. If you know what's in that 1,000-page tome, you'll have an amazing grasp of pregnancy and prenatal care. Then we're also pulling in for the rest of the entire year her other companion tome, the Bible, if you will, Understanding Diagnostic Tests in the Childbearing Year. We'll be doing much research and looking things up. You'll get to know how to navigate this book. You'll be using it for your entire midwifery experience. All right? Then, when we come to the second half of our program, birth, postpartum, the newborn, we'll be switching over to two amazing textbooks. First of all, we've got Oxhorn and Foote's Human Labor and Birth. This is the book I used to take to births with me when I was a baby midwife. It is clear, it is concise, it is an amazing journey into the physiology and anatomy and physiology, as it were, of birth and pregnancy as well. All right? So, and then we'll be using Varney. Varney is the standard of our CPM exam in this country. Varney's Midwifery, we're using the 4th edition. This is a hefty tome as well. We're using Varney for birth, postpartum, and the newborn. And you're aware, I'm sure, that Varney is a hospital-based book. All right? So we're reading Varney for information. There's lots of information in this book. However, we also know that at the Matrona, our focus is not hospital birth, it's truly undisturbed birth. Undisturbed birth, what does that mean? That means that nothing comes between a woman's instinctual, intuitive response to her pregnancy and especially her labor. We're translating the information from Fry and Varney into how it would look in terms of a practice of undisturbed birth. Now, to do that, we also have a whole other component that we offer you. We offer you, right alongside the academic year-long component, we also offer a full-blown intuitive component, we call it. Here, discussion, experience about the more instinctual, intuitive, relational aspects of caregiving. Here we're going to talk about models of care and a quantum paradigm. We're going to be talking about soul-level connections, deeper connections. We're going to be talking about cultivating the art of what occurs to you. We're going to talk about birth as an altered state of consciousness and the value of being in an altered state of consciousness during one of the most important experiences, one of the most transformational experiences you will ever have. We're going to be talking about trust and transparency. We also have classes on witnessing, on woundology, on wise use of our power. All right? So that's all in the intuitive component. We also have a very strong homeopathic component. I feel it is amazing to have a discipline that works and that you can refer to. Our main text here is going to be Sandra Perko's homeopathic textbook, Homeopathy for the Modern Pregnant Woman and Her Infant. In here, you will learn how to offer remedies for things like preeclampsia, gestational diabetes, hemorrhage, asphyxia, so on and so forth. We want you, when you end this program, to be able to use homeopathy for emergencies and also for the childbearing continuum. All right? So, to recapitulate, we have a strong academic section. We have a wonderful intuitive component. We have a big homeopathy component as well. We also have videos that we're offering you in terms of connection. And then what we also do too is twice a month we have conference calls where all the students can get on and we'll talk about different aspects. You can ask questions, or we'll have a question of the week and have discussions between all of us and maintain connection there. So, if this is something that interests you, and I hope it does, I hope you connect with us. The Matrona.com give you the information that you need. Join our program. I hope to see you. Thanks for listening.